After obtaining adequate anesthesia through topical anesthesia as well as injection depending upon the pain perception of the patient, we do a periodontal probing. What is periodontal probing? We use a periodontal probe to assess the pockets and the pocket depths. The more deeper the pockets, the more likelihood of the infection to be more severe. Once we are done with that, we start off with supra and subgingival scaling. Supragingival scaling means that the scaler is run over the gums on the tooth surface, and subgingival scaling is when the scaling is done below the gum. A little bleeding or sometimes profuse bleeding is expected in periodontal patients, as the infected tissue is something that is very edematous and the gums are also swollen. You are expected to get more bleed. The following section of the video shows what is known as root planing and curettage. Now these are collectively called for the patient knowledge as deep cleaning. This is the step, the interim step between the surgery and the normal superficial supragingival and subgingival cleaning. Basically what we do is we are taking out all the infectious tissue in a blind procedure, thereby making sure that all the excess granulomatous tissue before surgery is taken out and the infection load is actually reduced. So the more bleeding that is there, that means there is more infection, and as you can see we are doing the betadine irrigation in the place, and that helps in debridement of the area before we go for the surgery. Viewer discretion is advised when it comes to the bleeding of the pockets. The deeper the pockets, that means the likelihood of infection being more severe and the likelihood of the edema and all the inflammation present in the gums, which is not visible to the naked eye just clinically, is basically seen and appreciated while we are doing the root planing and curettage procedure. Root planing and curettage can be done in sequential order, such as quadrant wise, split mouth or full mouth sometimes if the need may arise. Now you have to understand that the need of root planing and curettage is very pivotal when it comes to the outcome of the surgery. The more thorough the root planing and curettage is done, the likelihood of the surgery time being reduced and the healing to be much better post-op is better. Here we can see tetracycline fibers, which are used for local drug delivery. Local drug delivery is a technique which is used in isolated pockets and sometimes in patients who cannot undergo surgical procedure for whatever reasons, and it is just like by the direct application of the drug into the pocket with the help of dental instruments, thereby directly releasing the antibiotic into the area where the microbial load is high. So this is all about root planing, curettage and local drug delivery as well as supra and subgingival scaling.